Hello guys. Welcome back to the channel. Let's crack it. Yes, we can. This is the second video for question answer for National Council Licensure Examination for Practical Nurses. In this video we are going to check next set of test questions for NCLEX-PN. So without wasting any time, let's check the questions. Question 6. A client reports pain levels of 8 on a scale of 0 to 10. Which intervention should the nurse implement first? A. Administer prescribed analgesic. B. Apply a warm compress. C. Assess the pain characteristics. D. Reassure the client that pain is normal. Correct answer is option C. Assess the pain characteristics. Question 7. Which action should a nurse take to prevent falls for an elderly client who is at high risk? A. Keep the bed in the highest position. B. Encourage the use of a cane. C. Place personal items within reach. D. Allow the client to walk unassisted. Correct answer is option C. Place personal items within reach. A nurse is providing care for a client who has refused a recommended treatment. What is the best response by the nurse? A. You should really reconsider, it's for your own good. B. Can you tell me why you don't want the treatment? C. I will notify your physician about your decision. D. You have to follow the doctor's orders. Correct answer is option B. Can you tell me why you don't want the treatment? Question 9. After a cholecystectomy, which of the following assessments is most important for the nurse to monitor? A. Urinary output. B. Bowel sounds. C. Wound drainage. D. Pain level. Correct answer is option C. Wound drainage. Question 10. A nurse is assessing a 6-month-old infant. Which developmental milestone should the nurse expect the infant to have achieved? A. Sits without support. B. Says mama or dada. C. Rolls over in both directions. D. Walks with assistance. Correct answer is option C. Rolls over in both directions. Question 11. A nurse is caring for a client with chronic obstructive pulmonary disease, COPD. Which of the following is the most appropriate position for this client? A. Supine. B. Lateral. C. High Fowlers. D. Trendelenburg. Correct answer is option C. High Fowlers. Question 12. A nurse is caring for a client in isolation due to a contagious infection. Which action by the nurse is essential to prevent the spread of infection? A. Wearing a mask only when entering the room. B. Using hand sanitizer before and after patient contact. C. Disposing of all linens in the client's room. D. Limiting visitors to the client. Correct answer is option B. Using hand sanitizer before and after patient contact. Question 13. A client diagnosed with depression expresses feelings of hopelessness. Which nursing intervention is most appropriate? A. Suggest the client snap out of it. B. Encourage the client to engage in activities they once enjoyed. C. Reassure the client that everything will be fine. D. Discuss the client's feelings with family members. Correct answer is option B. Encourage the client to engage in activities they once enjoyed. Question 14. A nurse assesses a client with dehydration. Which of the following findings would be expected? A. Weight gain. B. Decreased heart rate. C. Dry mucous membranes. D. Normal skin turgor. Correct answer is option C. Dry mucous membranes. Question 15. A nurse is caring for a 4-year-old child with asthma. Which statement by the child's parent indicates a need for further teaching? A. I will make sure my child avoids triggers. B. I can use the rescue inhaler when my child has an asthma attack. C. My child should use the inhaler before exercise. D. I can stop giving the medication when my child feels better. Correct answer is option D. I can stop giving the medication when my child feels better. Question 16. A nurse is monitoring a client with heart failure. Which assessment finding would indicate worsening heart failure? A. Decreased blood pressure. B. Increased heart rate. C. Weight loss. D. Increased urinary output. Correct answer is option B. Increased heart rate. Question 17. A nurse is caring for a terminally ill client who is experiencing severe pain. Which intervention is most appropriate for managing this client's pain? A. Administering a placebo. B. Using distraction techniques. C. Administering prescribed analgesics as needed. D. Encouraging the client to endure the pain. Correct answer is option C. Administering prescribed analgesics as needed. Question 18. A nurse is assessing a client's skin for pressure ulcers. Which area is most susceptible to pressure ulcers? A. Elbows. B. Heels. C. Forehead. D. Back of the head. Correct answer is option B. Heels. Question 19. A nurse is caring for a client from a different cultural background. Which action demonstrates cultural competence? A. Assuming the client wants the same treatment as others. B. Asking the client about their cultural beliefs regarding health. C. Providing care without considering the client's preferences. D. Using medical jargon to explain procedures. Correct answer is option B. Asking the client about their cultural beliefs regarding health. Question 20. A nurse is teaching a client about the side effects of a newly prescribed antihypertensive medication. Which side effect should the nurse emphasize? A. Increased appetite. B. Drowsiness. C. Insomnia. D. Weight gain. Correct answer is option B. Drowsiness. Thank you guys. That's all for the second video of NCLEX exam sample questions. Please like, subscribe and hit notification button to get more videos on the sample questions. I hope you like the video. Thanks again.